The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. I'm Physician Assistant Frank Smith. On this week's episode, we're going to discuss upper respiratory infections, the common cold. We're going to discuss what causes it, the symptoms, treatments, and why I'm not sitting on my own personal yacht right now. The diagnosis upper respiratory infection is in one of the top 3 presenting diagnoses in the United States. And we spend somewhere around $22 billion a year in the treatment and diagnosis of the common cold, upper respiratory infections. So I guess I'm kind of overdue on covering this topic. Let's start with the common cold. It's not common. Well, it's common in how often we get it. The average adult gets a cold 2 to 3 times a year, and pediatric patients can get it up to 8 times a year. But as far as it not being common, there's a lot of different things that cause it. It's estimated there's somewhere north of 200 different types of viruses that cause the common cold. The most common one that causes it is the rhinovirus family, but there are several subtypes within it. Rhinovirus does somewhere around 80% of the colds that we get every year. But some of the other options include adenovirus, enterovirus, parainfluenza virus, the human coronavirus, which predates its angry cousin, and RSV. As far as symptoms of a cold, we've all been there. Runny nose, sore throat, stuffy head, dry, hacky cough, all of the fun things in life that go along with having the common cold. Typically, symptoms show up somewhere between 48 to 72 hours after you're exposed to the cold virus. Symptoms usually last 7 to 10 days, but believe it or not, they can last up to 3 weeks. So if you're going in to see your clinician within the first couple of days of symptoms for your cold, it's a little early for it to even be considered anything else. There is one symptom that shows up that patients make an understandable wrong assumption about. I'll have patients come into the clinic and go, I know it's a sinus infection because my mucus has a lot of color to it. No. Color on mucus does not necessarily mean a bacterial infection. All it can simply mean is to be gross, aged snot. I understand where the assumption occurs, because if you've ever seen a boil, the pus that comes out of it has color, so patients see color in mucus and go, oh, well, that means it's a bacterial infection. No, and if you want proof of it, here's this. Every 3-year-old you've ever seen has a runny nose. They all do. What color is it coming out of their nose? Well, it's clear. What color is it on their sleeve? It's yellow, it's green, it's disgusting. Okay, well, that mucus didn't get infected while sitting on their sleeve. What that actually is aged mucus. So a lot of times when you see a colored mucus coming out of the nose or coughing it up, frankly, it's just aged, and that's what's produced that color. As the mucus gets thicker, the body has a hard time clearing it out, so it has a chance to sit there and sit before it comes up. So just because you've seen colored mucus does not mean that this is a bacterial infection. Treatment. Let's get one out of the way real quick. I can't, nor can any other clinician, cure the common cold. If I could cure the common cold, I would be sitting on my own private yacht right now, and I am totally not sitting on my own private yacht. We can't cure the common cold. And the question does come up, why can't we just do something about this? The answer is, from what I mentioned on the front end, there's over 200 different subsets of viruses that cause the common cold. So an idea of something that we can use to prevent the common cold as far as an immunization or a treatment that's tailored to a virus isn't going to work. And it gets worse. Not only are there 200 different viruses, there's a thing called antigenic drift. And what that means in English is over time, the viruses shift slightly. It's actually why we keep getting cold viruses. As it shifts, the antibodies that we have already produced on our previous exposure to a cold virus no longer match up well, so we're still susceptible to a cold. But there is no cure for the common cold. As far as treating the symptoms, here's the truth. You don't need me. You don't need any other clinician. And you probably don't even need to go to your pharmacy or to your grocery store. You probably have some of the things that really work well at home. For the cough, believe it or not, there's a lot of studies that one of the most effective things for a cough is honey. Honey works very well at treating a cough. Now, let me reference, if the patient is under the age of 1, absolutely not. And for me, I usually tell parents if they're 2 or under, do not. The reason why is there's a very small but not insignificant risk of botulism of honey to a really immature immune system. But in other patients, honey is a very effective cough medication. One of the other ones that I recently came across and tested it on myself when I had a cold was pineapple juice. There's an enzyme within pineapple juice called bromelain, and it helps thin some of the mucus that's produced during a cold. What I actually ended up doing was a combination of unsweetened pineapple juice plus honey. I heated it up, added a little bit of warm water. Did not taste great, but works extremely well. As far as the nasal congestion, there are some over-the-counter nasal sprays, but let me caution you heavily on those. They say on the bottle to not use for more than 7 days. They're not joking. The reason being is if you continue to use those nasal sprays, the nasal mucosa can become used to it being there to the point that when you stop using it, those turbinates, the tissues within the nose, reflexively swell back. So it's fine to use it for a few days, but do not overuse it and do not go longer than the recommendations on the package. As far as the nasal congestion and just the general sore throat and all of that, honestly, one of the most effective things is we need humid air. Dry air moving across already irritated mucous membranes lights them up. Humidified air helps soothe them. That's why I bet you've noticed before when you first step out of the shower, you actually feel pretty good. It wasn't the heat of the shower. It was all that moisture that was thrown into the air and you were breathing it in, and it helps soothe all those mucous membranes. So when you have a cold, we want a fairly humid environment. Whether it's a cool mist humidifier, a warm mist humidifier, having water boiling on the stove, anything like that to help soothe those mucous membranes. Warm fluids as far as hot tea, hot coffee, the pineapple juice and honey concoction I was talking about, all well worth doing. Dextromethorphan is a common ingredient on over-the-counter cough medications, but there's been several studies come out recently to show it's not particularly effective. Guaifenesin, however, does help thin secretions. If you're using guaifenesin, though, be sure you're staying very well hydrated. It needs that in order for it to do its job. So I basically said, you don't need me, you don't need any other clinician. At which point you go, okay, well then when do we need you? A good rule of thumb, if your symptoms have gone on for longer than 2 weeks, you need to come see us. If your temperature is over 101, you need to come see us. If you feel like your symptoms are involving the lower part of your lungs where you feel wheezy and tight and feel like you're not getting enough air, you need us. And frankly, if you feel like instead of I'm sick to no, I feel ill, you need us. There are some other things that can kind of look like a cold but can be more severe. So when in doubt, we're still here. But if you're pretty sure you just have a cold, treat it. And that's the common cold, upper respiratory infections. Hope you enjoyed the show. Hope you learned something. If either one of those is true, please click the like and subscribe button down below. If you think there's somebody else that would enjoy the show, hit the share button. Until next time, get better, make me look good. See you soon.